Hi everybody, welcome to episode 4 of Rehab with CEO, Pelvis and Upper Leg. This one is just going to follow the same pattern as the previous videos. Some really brief anatomy, some dysfunctions in the area and how you can fix these for yourself at home. So pelvis and upper leg is quite similar to abdominal and back in terms of that most problems, sort of sciatic issues, really unhappy hamstrings, they tend to be coming from the anterior side of the body. So tightness across the pelvis and lower abdominals, tightness through quads and hip flexors, just because of the amount of sitting and driving that we do nowadays. So I've had some particular or specific questions on IT bands and hamstrings from people, so I'm going to try and answer them as best I can in this video, and to why you're maybe getting issues with them. But just with the previous videos, if I'm not answering your question or you need some more information, please just drop me a message and I'll get back to you as soon as I can. I just want to say thank you again for following and subscribing, and the feedback I'm getting has been really overwhelming in a good way. So thank you so much for supporting me, and I just hope you're still finding these really useful and informative, and it's keeping you distracted while you're self-isolating. So let's go with pelvis and upper leg today. So Sid's probably not going to join in today. He just doesn't move well enough for me to show you pelvic movement, so I'll just be the body today, and sort of show you how things work. So he's not joining us, I'm afraid. So pelvis is kind of formed from 3 fused bones. You've got your ilium, kind of the big bones like at the top, and then your ischium comes around the back, and then pubic bone around the front. And they're like I say, they're 3 fused bones, so they're all joined together. They don't have individual movement. You've also got a little joint on the front called your pubis symphysis, and that can cause a lot of problems with people, especially if you've had a pregnancy. A lot of pressure with the weight of the baby going through there, but people get a lot of pubic symphysis problems from slip trip falls, again too much sitting, and that is just the little joint is just getting irritated, and it's kind of getting pulled based on the muscle attachments. And so I'm going to show you a nice little technique today to try and mobilise that joint yourself at home, to try and settle it down if you're having any pubic symphysis dysfunction, because that can be quite a painful and uncomfortable condition. So hopefully you guys find that little technique helpful. One thing that's quite interesting with pelvises is how different a male and female pelvis is. So a male pelvis is much narrower than a female pelvis, and that determines something called the Q angle. So we'll not get into the science of what a Q angle is. It just means that females have a larger Q angle than males, and it usually leads them to have more knee problems and hip problems because of that. So that's not great. But again, hopefully we'll show you some techniques today to sort out those imbalances, and you can help yourself with them at home. One thing I want to say is a little bit of massage geekery that always tickles me when I hear the song being played is the Time Warp from Rocky Horror Picture Show, and it's all to do with pelvic anatomy. So when Richard O'Brien and co always say, put your hands on your hips, what they actually should be saying is, pop your hands on your iliac crest and your anterior superior iliac spine. But that doesn't work quite so well as put your hands on your hips. So one thing I kind of try to stress to patients in clinic is, I would be really concerned for me and them if I was touching their hip joint. Your hip joint is quite internal to you. It kind of sits in and around here, but it's internal. I can't physically touch it. I can, however, touch your iliac crest and your anterior superior iliac spine. So it's a little just bit of massage geekery. It just tickles me a little bit when they say put your hands on your hips, because it's not actually anatomically correct, but that's just me. I do get a little giggle out of that. But we're a little bit different. I just like a bit of massage geekery. So moving on from that, hips are really similar to the shoulder, but they're kind of the opposite. So they're the same kind of joint. Hips and shoulder is a ball and socket joint. So when I discussed in the shoulder video about shoulders being really mobile but really unstable, because we get so much movement from them, they are really unstable, so you can easily dislocate it. Hips are the opposite. So yes, our hips do have extension, flexion, medial and lateral rotation. They can't fully circumduct like a shoulder can, but they are much more stable, and it's not impossible to dislocate your hip, but it's really unlikely that you'll dislocate your hip. You're more likely to break your hip, and that's generally from a really severe slip, trip, fall. And the reason the hip won't dislocate or is unlikely to dislocate is, unlike the shoulder where the head of the humerus is actually too big for the glenoid fossa, so the head of the upper arm bone is too big for the actual shoulder joint. The opposite is true for the hip joint, where the femur, so the head of the femur, is actually too small for the acetabulum. So the head of the top of your leg bone is too small for the actual hip joint, and it's almost vacuum packed into that joint through a series of multiple ligaments and a tissue called your labrum. So don't be damaging that, please, because then you're going to have some real hip issues later on. So yeah, the hips and shoulders very similar, just the opposite. One big thing I want to sort of clarify is with IT bands, because I get a lot of questions about this in clinic. So again, IT bands kind of go from lateral side of your pelvis all the way down to lateral side of your knee, and it's not a muscle, it's a bit of fibrous tissue, and it is not designed to be stretched. Please stop foam rolling it, please stop stretching it, you're just annoying it and it's going to give you more problems. Your IT band kind of acts like a rod, it's like a rudder for your leg. So what it's actually doing is, when it gets sore, it's because it's overworking, and it'll either be sore up here or down here. You can occasionally get pain through the body of it, but it tends to be at one end or the other. And if you tend to have a bit of a walk where you're collapsing in a lot, or you tend to sit a lot with your legs crossed, what you're doing is making that rudder work too hard to restabilize your leg. So you tend to get a lot of runners, a lot of cyclists with IT band problems down at their knee, swimmers as well who do breaststroke where they're doing that kicking action and rotation, or water polo players as well with the egg beating legs. It gets really gnarly down here, and like I say, that's because it's trying to overconnect this leg crossing the midline. So I'd want you to stop foam rolling it and poking at it. What you need to address is the adductors. So for all intents and purposes, you want a neutral leg. You want it coming straight down the middle and not crossing over and not being away out here. Not having like a Noel Gallagher walk, but also not having like a pigeon-toed walk either. You just want to have a nice straight walk. So the IT band is always overcorrecting tight adductors, and that's why you're getting an IT band problem. So get those adductors worked, get them stripped out and mobilised, and that'll take so much pressure off your IT band. So I'm going to show you a technique with a teaspoon though to just free off your IT band a little bit, but there's going to be quite a bit of adductor work here to just take the pressure off the outside leg. So if you're having an IT band problem, whether you're a cyclist, swimmer, runner, stop sitting with your legs crossed, whether it's like that or at 90 degrees. Just sit with your legs straight, and that should help that a little bit as well, but icing is quite good. But yeah, just please leave your IT band alone because it doesn't want to be stretched. It's trying to stop it being overstretched by those tight adductors. So yeah, hopefully you'll get some answers later on when we do some adductor stuff. Any other problems that can come from the pelvis is like if you've tripped or slipped on the ice and you get some pelvic torsioning going on there. That's not fun, so we'll try and do some stretches to just rebalance all of that. You can get a lot of tendinitis-y things, the pubis symphysis dysfunction that I spoke about earlier. But yeah, imbalances. runners who run around the track all the same direction have really underdeveloped adductors on the inside track leg and really overdeveloped quad muscles on the outside track leg. So there can be a lot of pelvic imbalance from that. Any sport where it's one-sided, one bowling and cricket, all one-sided, a lot of pelvic and back imbalances from that. So sciatic issues, a lot of sciatic issues in clinic just from people sitting too much, and their sciatic nerve is either getting impinged because they're literally just sitting on the nerve all day and it's getting really fiery, or their back, they're having some disc issues. But if you release off their quads and hip flexors and lower abs, you tend to see a big improvement in their symptoms. So we'll get cracking with some of these little exercises today, and hopefully you'll feel that your pelvis and upper leg is a little bit more happy. A lot of the techniques I'm going to show you today are actually kind of stretches, and they actually complement really well with the abdomen and back video. So if you go back and watch the abdomen and back and then add these ones in, you've got a really nice rehab program basically for the whole midsection of your body, and your body will thank me for it, I promise. So yeah, let's get cracking with these, and like I say, any questions later on, let me know, and we'll see if we can answer them for you and get your pelvis and upper leg a bit happier. So I'm just going to move this so you guys can see a little bit better of what we're going to do. So first one we're going to do is some Shakti mat stuff. So we're going to use the mat and the pillow. So basically I just want you to lie on it, a little bit like I showed you in the last video. You're just going to lie kind of like 5-10 minutes just to get a really good blood supply into the quads and get some of that nice little acupressure effect, working through all little myofascial adhesions in there. So like I say, you just roll the mat out, and all you want to do is just lean down onto it and just lie there, just nice and comfy, read a book, watch a bit of telly. It doesn't have to be anything too taxing because you want to get the benefits of just lying there. So lie on that for a little bit, and you can kind of finish the video lying on that as well. It's quite nice. But then you're going to get the pillow, which I love this little gadget. You can do the same with the mat. You can just roll it in the reverse. So basically roll it up like that, and then you can lie on it like I'm going to show you with the pillow. That works the same. I just really like the pillow because then it saves me having to roll the mat, so it's just a bit of laziness on my part. But that works quite well for this too. But I'll show you with a pillow. So with the pillow, you want to work it through the different sections of your adductors. So like a sort of upper, middle and lower section. So once you've lain on the Shakti mat for a couple of minutes, same thing with the pillow. Take it kind of as close to your groin as you're comfortable with, and almost come into this hurdle type position, and just let yourself sink into the pillow. Again, maybe a minute, 90 seconds, and then just gently come off it, take it a little bit further down, lie into it, 90 seconds, something like that. See what your discomfort levels are, come off it, and then come down towards the knee end. That'll probably be quite uncomfortable. The middle one is probably the most comfortable of the 3 sections, but I'm not claiming that any of them are they're that pleasant. But it's actually a really nice technique, and your leg will feel quite different after it. So give that a little bash too. And do the other side. So once you've done them, get your trusty Franklin ball, and kind of same as what we did through the abdominals. Start at the knee end, so the opposite of the pillow, and work towards your groin. And all you're going to do with that again is just open it all up, just get loads of blood flow in there, get loads of oxygen in, which is then going to try and help flush out any waste byproduct that's there, all the way across the top of the leg. You can come onto the other side of the leg as well, and again to the other side. Spend again a minute, 90 seconds across the whole leg, just opening all of that up. And then get your trusty spiky ball. With this technique you can use a foam roller. If you don't have a spiky ball, I'll show you the foam roller version. I personally just prefer the spiky ball just because it's a little bit more pinpoint, it's a little bit more particular, and anyone who works with me in clinic knows I'm very particular about certain things, so I like the spiky ball. I'll show you the foam roller too. So going back to the time warp, I want you to find that ASIS. So if your hands are on your hips, like Richard O'Brien says, you're just going to kind of come down the front and you'll find a nice little bony bit in there, and then just off it there is a nice little meaty bit. This is scientific as we're going to get. So just onto that first little meaty bit, you're going to lie on the spiky ball. So lie onto it and just try and let your pelvis relax. Like don't be sitting rigid on the ball, really just relax into it. You're going to relax for 20-30 seconds on the ball, and then what to do is just gently roll around the ball and find these little yucky hot spots that I kind of keep talking about in the videos, these little myofascial adhesions. So find the little yucky hot spot, which is kind of about there for me, and once you've found it, again, just relax onto the ball and then just do some really gentle, nice, slow and controlled knee bends where you're bringing your heel towards your bum. So you want to do 3 to 5 of these on each little hot spot. And once you've done those little knee bends, you're then just going to sink in again to the ball for another 20 to 30 seconds. Once you've done that, find the next little yucky hot spot, kind of around there, and just do the same again. Just a nice, gentle bend and straight of that knee. And basically, you're going to work all the way from that ASIS, so your anterior superior iliac spine, all the way down towards your knee, and that's actually really lovely. And then you can do the same on the adductor. So it doesn't really matter again if you want to start at groin or knee end. It's not an issue. You're going to kind of do the same thing. So lie on the ball, let yourself sink into it, and then just do a really gentle shuggle. It's a good Scottish word, shuggle across it. Just nice and slow and controlled, and then find the next little hot spot, sink into it 20-30 seconds, and then do a nice little roll along it, and you're going to do that all the way down towards your knee. So that should take you a good couple of minutes on each side. Like saying, just hold it and melt into it, and that's really good for trying to break down those little adhesions and sink into it. Next bit, 20-30 seconds, just a nice little gentle shuggle, and then find the next bit and work all the way down there. If you want to use a foam roller, exact same thing. Just sink into it, give it a little bit of a roll, find the next bit, give it a bit of a roll, find the next bit, give it a bit of a roll. You kind of want to work through the leg in thirds, whether it's the adductor or the quad. So same thing if we're doing the quad. Just bend and straighten it, roll, bend and straighten, roll, bend and straighten. Really, really easy, just not that comfortable. So once you've kind of done all that to get all the blood flowing and get all that moving and mobilised, we can then start doing some nice stretching through it. So I give a lot of quad stretching in clinic because I treat so many people who sit in office jobs, but they tend to already tell me they're doing quad stretching, and when they tell me what they're doing, it usually involves them standing up, losing balance, and usually aggravating their problem. So a nice alternative to a standing quad stretch is a lying quad stretch in like a running shape position. And it just means if you're going to fall, you've not got that far to fall to because you're already on the floor, and it's just a little bit easier. So I really try to keep things as simple as I can, because if you give people complicated rehab, they don't do it. If you give them easy rehab, they're a little bit more inclined to do it, but even at that, it's a push. So that's why I'm trying to make these as easy and fun as I can, although I'm not sure if you can really define rehab as being fun. But so an alternative to a standing quad stretch is, like, say, getting yourself into a running position with, if we were stretching the left leg the right leg's in a running position. You're going to lie out, grab the left foot and just gently bring it behind you. So like say you're not going to really do yourself a mischief. You might roll back a little bit, but that's kind of why this right leg is bent. That's kind of used as like a stabilizer to stop you from rolling back the weight. So you want to try and make sure your left knee is in line with your left hip. And again, depending on comfort levels, depending on mobility, you want to lie here 20, 30, 40 seconds and then slowly build it up to a minute as the weeks go on. And then you can do the other side as well. So just to show you guys another side, like say bent knees if you were running, and pull the leg back. And it's so much better than try to stand up and do it and fall all over the place. A nice little adductor stretch that I love doing, I actually quite often sit like this in the living room, is getting against a door or like say the back of the sofa, or against the sofa because it stops you folding into it. Is feet together as close to your pelvis as you can and just let your legs flop out, and that's a really good one for opening up all that in there. What you can also do is just gentle pressure off your hands and push down onto your knees. You're not trying to push your knees through the floor, just a nice gentle stretch. You can sometimes just do one side at a time. That's a really, really nice one as well. Again, 20, 30, 40 seconds, see how you feel. And then you can build that up to a minute if you'd like. If you then want a slightly stronger variation on that, I'm just going to pull this cheek across. What you can do is either on the edge of the sofa, a unit, a stool, whatever you've got lying about, if we're stretching the left leg, up onto the unit, and just gently walk your hand down towards that foot. And that's so good for opening up all through there. And like I say, this is going to take a lot of tension out your IT band. It's going to take a lot of tension out your glutes as well, because what you will find is as the adductors get tighter and tighter, your legs will rotate in the way. And as they rotate in the way, your pelvis will drop forward. See a lot of people walking about with this little duck posture. And what that then does, it's all about this shortening and lengthening of the muscles. So as you rotate in and duck forward, your glutes are on so much stretch, as are the hamstrings. This is obviously a massive over exaggeration, but this is how people walk. And then they wonder why their glutes and hammies are always tight. So opening up all the way through those adductors is really, really lovely for taking all that tension out through there. So once you've then done the adductors, get your trusty teaspoon and we're going to do some IT band work. So a lot of upper leg muscles attach around the knee at slightly varying points, so this can get really congested. I was kind of going to save this for the next video. We'll probably do a little bit of that in that video anyway. So take your teaspoon, just like how we did with the shoulder on the pec, and with the angle of the ribs, you're going to do like a fanning type motion. Just come a bit closer so you can see that. So to find a sort of landmark, I'm going to be a little bit massage snobby here. I'm going to come anteriorly, laterally, and like on an oblique angle, basically this top diagonal side of your knee, just coming into your quad, and we're just going to do that a nice little fanning motion. Again, you might want to use a bit of wax or olive oil, facial cleanser, facial moisturiser, depending on how dry your skin is. My skin's normally quite dry, it's not too bad today, so I'm not going to use any wax, but if you've got any of that lying about at home, use that just to give yourself a little bit of something to work through. So yeah, you're just going to do a really nice gentle fanning motion all around that knee. And as you kind of come off the kneecap into the lower leg, I don't want to talk too much about the lower leg, I want to save that for the next video, but you'll find the head off your fibula in here, and in the next video I'm going to show you how to mobilise that a bit. But at the moment, before we mobilise that, get your teaspoon and fan across that, because that will help with mobilising that at a later stage. So just work all the way through this, all that sort of scrapey action, and then on the other side, and then you can start working up towards the pelvis. And normally if I was in clinic, I would put some needles around someone's knee and up into their quad and work through all that. But what you can do at home is really concentrate on that sort of last inch, 2 inches between your upper leg and knee, because that's then where your main quad muscle starts to become in quite tendinous, and that can get really grotty in there basically. You have to remember that your main quad muscle actually travels through your kneecap and attaches on to your lower leg, so it's quite nice to work through that, to open all that up, and again just take general tension out of this upper leg. So loads of nice fanning motions all through that, and don't forget to do your other leg too. Then I'm just tightening my leg so I can check where my IT band is there, just so I can show you guys. So middle to back of knee, you can start to find your IT band. So there's mine there, and you can trace that all the way up to your hip. So we'll work the bottom side first before we work the top side. Again, teaspoon, you're just going to hook up underneath it, and a bit like kind of how we worked the ribs, you're almost just going to like pull up and into it, and do that kind of pulling away from, you almost want to pretend you're just gently taking your IT band off your leg, but be gentle about it, don't be too rough. And all you're doing is just try to mobilise it, just try to get some oxygen and good blood flow into that. Because it's under so much tension all the time, because it's trying to act as this rudder to bring your leg out and stop it collapsing in, it just gets so much tension through it, and the tighter and tighter, or the more tension that goes through something, it just can't work as effectively as it should, and therefore its blood supply isn't as efficient, its oxygen uptake isn't as efficient, but therefore its carbon dioxide waste removal isn't as efficient. So it's just nice to mobilise all that and get rid of all that rubbish. So like I say, work through the bottom half all the way up, and then here's the top half. You can do the same from the top half. So you're then just going to fan it all the way down, and actually as I do that I can feel that up at my hip, so that definitely tells me that's a little bit tight too, or unhappy. Tight's the wrong definition. And work all the way up that side, and do the same on that one. Once you've done that, then we can start doing some nice glute stuff. So a nice little one I like to do is cross, if we're doing the right side, cross your right leg over your left, and you just want to hug your knee, your right knee towards your left shoulder. Again, 20, 30, 40 seconds. It's all dependent on comfort levels and flexibility. And from this 12 o'clock position, your upper body can do a slight rotation through the clock. So you can come to 1 o'clock, again 20, 30, 40 seconds, see how comfortable you feel. Then you can come to 2 o'clock, and then you can go a little bit further to 3 o'clock, and that just gets different fibres all through that glute. Then you can do the other side. Then you can follow up with a little a yoga pose called fire log, where basically you stack your legs on top of each other like logs of wood. I'm a little bit tight through here, so my right knee doesn't quite reach my left foot, but that's okay, it's something for me to work on. But once you're stacked here, you can just sit, breathe through it. You will tend to feel this through this outer side of your hip. I can feel it a little bit in here, which is kind of where you want to feel it. So like I say, comfort levels dependent on how long you want to sit there for. But once this gets a little bit easier, what you can start to then do is not slump into it, but just do a really nice gentle chin to chest and roll on through and you will eventually get yourself to the floor. So that's my arms on the floor, head still got a bit of way to go, but see which side is easier. You can use a yoga block to support yourself a little bit more. I think both of my, oh, this will be a bit more flexible than I was expecting. So obviously my left side is a little bit easier. So again, you can just roll forward into it and see how much closer or further away you are. And this is actually a really good pose for really highlighting imbalances in people's pelvis. So that a lot of patients don't like it when I give them this exercise, but actually it's a really good one for telling us just how much imbalance it is. So you might not like this one, but I really want you to stick at it, unfortunately. So that's another really good one too. And then one of my favourite exercises I should probably give out a little bit more is a little baby rock with your hip. So it's a really nice one for getting that femur head all unlocked. So basically you want to pretend that your lower leg is a baby, so be gentle. So you're going to pick your baby up and give it a nice little cuddle, and what you're then going to do is just gently rock it as if you're trying to put it to sleep, and try not to be thrashing your whole body around when you're doing this. This is just a really nice gentle mobilization for that hip into your pelvis, and what you're effectively doing is internally buffing any little adhesions that are appearing between the femur head and the actual joint that the femur sits in. So that's a really nice little technique too. And again, it's quite a good one for sort of showing you different imbalances. So I actually find it much harder to pick up my left leg just to get into this position. So there's definitely some other imbalances going on there that's not just from my hip. So that's quite a nice little exercise for highlighting other issues that's going on in the body too. So you can give this a little try, again, very flexibility dependent, if you can even gather your leg up, but definitely give it a bash and see how you go with it. And then the last one I'm going to show you guys today is a little hamstring pin and stretch. I didn't really want to do an awful lot of hamstring stuff because I know that you guys are going to get so much relief from doing all these quad, adductor and glute exercises. So if you really have any burning questions about really particular hamstring stuff, just drop me a line, but I can promise you that your hammies will start to feel a bit better doing these ones. But yeah, the last one I'm going to show you is a nice little pin and stretch. So just going to pull this chair over. So get yourself on like a dining room chair. Try not to do it like on your sofa or your bed because they're just a bit too soft. So you want something that's a little bit more robust. And you're basically going to sit on the ball, and kind of similar to what we did with the quad and adductor, you're going to melt into it, bend and straighten your leg, and you're going to work all the way from bottom of pelvis all the way to the back of the knee. So coming down onto it and trying to relax as much as you can into the ball, and then just gently bend and straighten that leg. Again, 3 to 5 times, just like we did before, and then roll down through the ball, find the next little yucky hot spot, and work through that. It's nice and slow, nice and controlled, all the way through the muscle till you're eventually down towards the knee and finish off down there. Just try to keep it as controlled as you can. My leg kind of wants to drift off a little bit, so clearly I have to do some work myself through that. But that's a nice little technique too. And like I say, your hammies will thank you because, like the IT bands, with it being continually overstretched and overworked, it isn't getting to be as efficient as it can be. It's not getting that oxygen uptake. It's not getting that waste byproduct flushed out. So you get a lot of adhesions to the hammies where people feel their hammies are tight, but actually they're just too tensioned and a bit adhesed. So that's a great little pin and stretch on the chair for working through all that. So I hope you guys find that helpful. Like I say, any particular questions, drop me a bell and I'll get back to you as soon as I can. Happy Easter, have a good weekend, bye!